The bottom line to this, and you can see from that limited explanation of what we're doing in our study, how complex that exchange will be to address all the different facets of it. In fact, we have private industry involved in it. There's a Medicaid integration there, the federal Medicaid money that comes down the line. The regulatory part of that, the conduct of the navigators and the agents and the companies who participate, that has a direct effect on your constituents. And we're not asking the legislature to do any firm commitment on the affordable health care plan whatsoever. All we're asking is to be able to continue to develop the process for the exchange. And come June of 12, that's going to be Fisher Cut Bait to the feds. We don't have to say we're going to have an exchange. We can take this planning money and we're going to listen to the people of the state of Arkansas, the companies who do business here, the constituents, the legislature. And so we've got to keep doing that. Now, if you agree about how complex it is, throw that whole process to the federal government and let them handle it, the feds. And then try to respond to the people that you and I are responsible for. And you all know, and almost everybody here at one time or another has talked to me on a different constituent issue, and that is primary for our agency to respond to that. And we do it to the best of our ability. We just don't want to lose that ability to take care of the people of the state of Arkansas. That's the bottom line. Unlike the federal affordable health thing, that is a United States congressional effort. It's going to depend on a lot of outside influences, the U.S. Congress, the election of the president or not. All of that is out of our control. But what I don't want to do is lose control of this regulatory part of operating this until you all tell us in June of 12 that you don't want to do it. It's a call there. So I know it's an emotional thing. I know it's. We had this session and it was a hot issue, and it got really all encumbered in the national scene and the national dictates and all that. But this, is just home rule. And you, as a member of the legislature, have the right to call that commissioner, whoever he or she may be, and to say, well, I want you over here at 11 o'clock Friday morning to respond and answer to the needs of my constituents. It goes to the feds. That's going to be very, very difficult. We do all the constituent work for the National Congress. Republicans, Democrats, they get a case on insurance, we regulate it, we take it. We take care of their business. We take care of their political business. We want to respond to their constituents. That's all we're saying here. Getting all involved in this debate about the big picture, trying to stay out of it, folks. But I do, in my heart of hearts, believe we need to keep planning. You're still in control. You can pull the trigger. You're not telling we're going to do it. I'm just trying to keep us in the hunt. We don't do this. I'm going to talk about the grant. A lot of you all have asked me about this grant and the process. The governor has said to a lot of you all, I think, and that he is taking the legislature at the position they were during the session. Well, we've had a whole lot happen, a lot more process happen since then. Instead, it just went over. And so what we're going to be asking you to do, and I know that you all know there's a lot of private interest in this. There's a group out there that it's not secret. It's the Hospital Association, State Chamber, Blue Cross Blue Shield, and insurance agents that are quite fearful of losing this to the federal process for the right reasons, because they don't want to have to deal with that bureaucracy. So they're talking to you, I know. And what they're going to be asking, and I'm going to be asking too, is to give an indication to the governor. Doesn't have to be 100% of everybody, but it should be at least a large majority percentage. Democrat, Republican, we're not talking about a party deal here. To say, we are not agreeing to the local exchange. We're not agreeing on anything having to do with affordable health care, but we do want to continue the planning process until we decide we don't. Now, we don't get a letter governor, with your encouragement to go the process, we're bailing. We're bailing out. And if it's too soon to bail, you got plenty of time to bail. You can bail in June of 12. You're in control, but not now, because we need to go through this process. We do it with you jointly. We are strictly thinking of Arkansans on this. This is not a partisan deal, not from your commissioner whatsoever. And so that's it. We're going to have to give an expression to the governor that we want to continue the process, and you can say in that same expression, by golly, we're not agreeing to a local exchange. So that's kind of bottom line. I want to cut through it. Y'all are busy, you need to go back home. But that's it. That's what you're going to be asked, and we got to do it pretty quick. I know it. He owes some of you, okay? Yeah, I'm sorry about that. You know, we felt like we've been quite open with it, but maybe I know how many issues you have on the table. This is not, hasn't been there as much. And so, anyway, that's the bottom line of it. We're not asking for much. We're just asking to keep Arkansans in this thing.